Welcome to the fifth. Don. It's my job to support the leaders at Don, like addressing insecurity. And I'm grateful to you for taking time on your Sunday afternoon to come and hear an amazing panel to tackle this subject. And this town hall today is the first of a series of 6 we're going to do throughout the year. We're celebrating our 150th anniversary this year as a church community working in the broader community. So throughout the year, we'll have different town halls on different subjects of importance in the community. And there's a whole brochure listing all of them on that table. But today we're talking about a topic that is really close to our hearts here at St. John's as a faith community. And the injunction in our faith, which is shared by so many other great faiths and by people of no faith but great humanity, which is love your neighbor. And I was hungry and I fed you. I was given something to eat. I was hungry and I was given something to eat. It's an article of our faith and a matter of justice that people should be fed. And we did just that during COVID, when we established a food distribution called Nourishing Bethesda, which you'll hear more about later. The overarching context for this discussion today, though, is that based on the 2023 Capital Area Food Bank Hunger Report, which is a fantastic report, this area, this region, the DMV, suffers from what they call a staggeringly high and stubbornly high level of food insecurity. Last year, it was 32% of people in this area did not know from one day to the next where their next meal would be coming from. This year, it's gone up to 33%. And according to an article in a recent article on the Hunger Cliff in Bethesda magazine, more people are suffering food insecurity today than they did during the pandemic in Montgomery County. So this is really, it's a really serious problem. And we have to ask ourselves, why is this continuing, persisting, and why are we tolerating it? Why should it even be acceptable that there's hunger in a place where we have more than enough food to feed everyone? And so that's the context. And what more can we do to eliminate, reduce, solve this problem? That's why we're here today. And we are so lucky that we have an incredibly distinguished panel of people. I don't want to block them as I introduce them, but you probably know many of these folks. Some are on the side of food provision, some are on the side of government, helping set the context, find the funding, and rally the county to address the problem. Jackie DeCarlo is the CEO of MANA, which is one of the longest serving and largest community organizations that are trying to provide food for all in this county. MANA's been a pioneer of many innovations, including choice pantries. We'll talk more about that later. But also, Jackie and MANA have served as mentors and friends and nurturers and supporters and connectors in the community of food providers. And we thank MANA and Jackie for that. And then we have the Reverend Kendra Smith, who is a friend of ours from AME Zion, Kingdom Fellowship, AME Zion Church. Kendra is a clergy person there who manages their ministries in community. And she was the founder of their, which served as a huge inspiration to St. John's in establishing Nourishing Bethesda. And Kendra does many other important things, but I'll just leave it at that. John Ross, we know well here at St. John's. He's a longtime member of St. John's, in his other life, a noted author, but today he's here in his capacity as the executive director of Nourishing Bethesda, which is the food distribution that we established, starting out feeding about, I guess it was 100 families, 400 people in August of 2020, now feeding over 1,000 people a week. We thought this would end after COVID. It hasn't ended. It seems to be growing. And then we have Gabe, known as our county council member at large, a champion for a long time in his role as the chair of the Health and Human Services Committee for the council, and in other ways too, a champion of fighting food insecurity. And this year announced a very important new program, a strategic plan to end child hunger in Montgomery County. And I just love that title because we can do it. And we're going to hear some from Gabe today about how it can be done. Do you remember how Montgomery County decided to end veteran homelessness? And Bethesda Cares and other organizations ended veterans homelessness. And Heather Bruskin, who has also had many roles in fighting food insecurity in her career, is the new office of the Montgomery County. It's the new director of the Office of Food Systems Resilience in the Montgomery County government, relatively new and but she also serves as the co-chair of the Maryland Food Systems Resiliency Council, and she's held many other positions, looking very carefully at what is the problem exactly, how do we define it, how do we measure it, so we can come up with the appropriate solution. And her philosophy is it takes a village. It takes a networked village of people who are addressing all aspects of what is actually a fairly complex problem to address. And I am very confident that after you hear from all these people today, you will leave with a real appreciation for how serious and how unacceptable food insecurity in our area is, and what we can do together and together to begin to seriously. So with that, I will just do a few opening remarks. Anything you'd like to do in that 5 minutes is fine. We were thinking maybe not some. It's about around this issue. Why is it important? Can we solve it? What's stopping us from solving it? Whatever you think is most important for our audience to hear as we launch this discussion. Then we'll do a little bit of panel discussion, a few questions, and then we'll turn it over to ask them anything you would like. So thank you again very much for coming. Bill, is there housekeeping you need to do with our Zoom audience?
In terms of the Zoom meeting, when we get to Q&A, you're all muted at this point, but you can raise your hand and then we'll call on you, and then you can unmute yourself, or you can also just put your questions in the chat, and then we'll find an opportunity to raise them, and I'll do my best to raise them for you. I think that's it.
That's it.
And by the way, we are recording this meeting, just full acknowledgement, so this will be recorded and available on.
We'll very much want to share the wisdom that emerges today.
Yes.
And you'll have to line up with that microphone. It's a question time to offer questions. So that, let's turn to Jackie. Start.
Thank you, Reverend Ann. And thanks to everyone who's turned out, whether on Zoom or here, to be part of this discussion. I'm looking forward to the discussion the most. So I will try to do as Reverend Ann said, speak from the heart, and look forward to the dialogue. It's very intimidating to be with people like Reverend Kendra and John and Gabe and Heather. I'm sure, though, that if I say anything wrong, they'll correct me or amplify, and that I'm also sure we'll learn the most from you all. I will take a minute of my time to thank this congregation for being such a strong supporter over the years of Manna Food Center. We are a secular organization, but our roots, we're speaking of root causes, our roots are in faith communities. We are 40 years ago, were brought together by what was then the Department of Social Services and what was called then Community Ministries of Montgomery County, now Interfaith Works. And it was an opportunity to bring together people of many faiths or no faith at all, to work together to make sure that there was one organization that was focused on eliminating hunger by sharing food, educating, and advocating. And so thanks to those founding congregations for making Manna's 40 years of service possible, but also people like yourselves who are so interested in this and sometimes volunteer or work on our teams to make it possible. What I wanted to start with is the story of a neighbor. Ann mentioned the Hunger Club article in Bethesda Magazine. They profile a woman named Miss Chelsea Lewis, somebody who has sought services for Manna and other food assistance organizations. She's a mom, a single mom, lives in Rockville, has 3 kids. And sometimes she skips her meals or skimps on her meals. She'll have oatmeal for dinner while her kids are having the chicken that she's been able to receive at a food assistance organization or paid for. And she's noticing that her teenagers are now catching on, that mom is not eating as much as she needs to. She's one of the people that we consider food insecure in Montgomery County. We sometimes talk about hunger. Hunger is a physiological condition, right? We all feel a little bit hungry. But when you don't always know where your next meal is coming from, that is food insecurity. And that's what happens far too often, as Ann was saying, in this wonderful community and then in this region. And for 40 years, we've seen lots of economic cycles. We've seen only one pandemic, but when I look at the root causes of why this happens, why there's acceptable almost levels of food insecurity, I want to share 3 root causes. I didn't come up with these. There are many others that we'll probably talk about, but as a white woman, I need to acknowledge that this country was born with the original sin of slavery. If you look at Montgomery County, about 10% of our population is white, but about 40, well, I want to make sure I get the these stats correct. 40% of our county is white, but only 10% of the people who turn to us are white. Meanwhile, 18% of our county is African American, but 24% of the folks who turn to us are. So that's very lopsided. And I think it's just one small indicator that we have a lot of work to continue to do on making sure that racism is confronted. Also, as a woman, I think we have to recognize that sexism still disadvantages in the economy women. And when we talk about food insecurity, we're talking about, in many cases, an economic problem. 75% of the people that come to MANA are women. People like Miss Lewis, who I just spoke about. The third root cause, and Anne did say I could be provocative. So the one I want to share, I first want to talk about my bona fides, right? So I mentioned that MANA was created by the many faith congregations. Right now we have partnerships with Christian, Jewish, Muslim, Buddhist, and then organizations with, that are secular. But we know that there are many faiths that have hunger ministries, mostly all faiths that we interact with. I myself was raised Catholic. I worked with Catholic Relief Services in Baltimore for 7 years and was really molded and shaped by Catholic social teaching. I now worship not far away at the Bethesda Friends meeting, doing part of the Quaker community. So I'm in no way suggesting that my concern is a concern as a person of faith, even though many people at MANA are not people of faith, or they are people of faith, the same people who turn to us. But I do think that those of us who have faith traditions that we lean on have to look at the mindset of our charity. We often know what to do from a charitable standpoint, but we don't know what to do from a justice standpoint. And of course, there are going to be emergencies. There are going to be pandemics. There are going to be divorces. There are going to be health considerations, that people have crises, that they have to turn to a MANA or Nourishing Bethesda or Kingdom Fellowship. But those should be points in time that can be resolved. Our vision at MANA is that all people at all times have access to good food and welcoming spaces so that they can be cared for when they need it, but then that they have the nourishment and the health and the energy in order to be participating members of their community. That should not be a long-term problem. But when I'm in the lobby at our marketplace in Silver Spring and I'm chatting with folks, more times than I like to admit, people thank me because they've been coming to MANA for 7 years, 10 years, that they just rely on us as part of the social safety net. But safety nets are supposed to catch you when you fall, and then they're supposed to help you bounce back up. But I think that sometimes people of faith have a mindset that the poor will always be among you. And I know myself, there's sometimes I think of that when I look at immigrant populations. My grandparents came from Sweden. They didn't speak English. They actually didn't do very well. My father and his siblings fell into foster care. So sometimes I think, well, it's part of the immigrant experience. You have to be the low rung on the ladder. But then I have to check myself and say, no, but again, foster care saved that family. But what are the opportunities for the children to be fed, to have the kinds of jobs that end up where somebody's able to run a nonprofit? We have to think, I believe, as much as we do about doing those food drives and doing deliveries in our cars to people who need food. We have to have as much interest and energy in those activities as why is it that it is so hard to afford to live in Montgomery County, whether it's a question of housing or immigration status or just the culture of our society. So I believe that a root cause is that we need to move away from charity as the only response, but justice. If we work on the focus on justice and not just charity, I think that's what will make it more likely for us to have a food secure county.
Thank you. And
Good morning, everyone, and thank you so much for the opportunity to be here. I consider it a privilege and I consider it a blessing. And so I'm very excited about the opportunity. I had some notes prepared, but Anne shifted me a little bit when she talked about just speak from your heart. And so Kingdom Fellowship AME Church, where our pastor is the Reverend Dr. Matthew L. Watley, we became involved in responding to the food insecurity that we saw happening during the pandemic. It's always been here, but we all know that the pandemic exacerbated the need. And so people who we didn't think would be faced with having enough food on the table were faced with having enough food on the table. And so as a faith-based organization, we had no experience in operating a food distribution. We did our general Christmas, Thanksgiving, all of the holidays, but we did not have a concentrated, focused effort to address the issue and the problem. We just got involved. And as a faith-based organization, that is what we are called to do. Sometimes we want to overanalyze a situation when we just need to get involved. And when you get involved, you begin to understand all of the factors that are impacting the situation. And then you can begin to analyze and unpack and begin to create a strategy. The challenge with the church is sometimes we look from a distance because we feel that we don't have enough to get involved. And we think that there's already other people in the game that are involved. So what will my small part have to play? Biblically speaking, that is theologically incorrect. God calls us to get involved where we are, to do what we can with what we have. The Bible is very clear for us that to know what to do and not do it is sin. Faith without works is dead. And so for our congregation, our culture, and I think it's really important because when people look at our congregation is predominantly African-American, but we have all ethnicities represented. But our congregation is middle class, high income. That's who we serve. But we take that as a privilege and we understand that what God has given us to steward. And so we steward that in the place where there is greatest need. So what happened during the pandemic, because we were shut down in certain areas, our pastor, who was a Howard University graduate, he's very business and entrepreneurial minded. In addition to being a man of faith, he pivoted our budget. And he said, well, here's the need. We're no longer doing this. So this is what we're going to do. I'm going to make an executive decision. We're going to pivot the budget and we're going to take X number of dollars and we're going to commit it to this area because there is a need. And so sometimes I quote often when Jesus fed the 5,000 and what can we do with 2 fish and 5 loaves? Not much. Jesus said, yeah, I know what I'm going to do. And so, of course, we all know how that story ended. What they thought was insufficient. They thought what they had was not enough. When Christ and faith came into the picture, it became more than enough. Not only did they feed 5,000, because that was only the men, there were women and children in the crowd. They had more left over. So Reverend Kendra, what's your point? My point is that we invested what we could and what we had before we received any funding from Montgomery County, before I received any funding from Prince George's, before I received a grant, a contract. We took what we had, invested it where we needed it, and then out of that consistent investment, we continue to build partnerships, collaborations, not silo ourselves out. We are not trying to build an empire. We're just trying to do the work. And as we did the work, now I will say our church, our culture is we have strong infrastructure, right? So we had infrastructure, we had systems, all that was there, but we had to pivot it in order to respond to the need. And as a result of that, That's where we started. So I tell every church, regardless of whether you can feed 25, because I'm also a church planner. So I founded a church, Rivers of Life AME Church, and pastored for 7 years. And I was doing the exact same thing in that same location. I just didn't have a lot of money. So instead of feeding 2,000 people, I fed 20. But the concept was the same. So for any church, any person of faith, if you feel the call to get involved, to give of your time and to give of your money, I encourage you to do it, because when we all do that together, then we're able to work towards a solution, right? Instead of sitting back and thinking that what I have is not enough. And that really is our story. We just got involved where we were. And as we got involved where we were, other resources came. And as other resources came, we just continued to build, but our focus was on the need. So we went directly into community. And so we serve in those communities in Montgomery County that had greatest need. Those areas were identified by the stakeholders, the people that live there. And then that's how we continue to do the work that we're doing. Thank you.
I just want to thank Jackie and Kendra for bringing out a couple of issues I hope we can get into more deeply. We know that we have to deal with the day-to-day issue of helping people put food on the table, and that's kind of what we do. But that isn't the only issue. As I often say at St. John's, we have to do the systemic advocacy, the justice issues of changing systems so that the problem isn't constantly created and becoming permanent. So thank you. We really need to look deeply at that, even as we look at the innovative ways that we address food insecurity today. And then I also have to say a special thank you to Jackie and to Reverend Kendra, because during COVID, we participated in a Zoom conversation online that was hosted by Jackie called Breaking Bread, where they were discussing the theological basis for food security work. And Kendra spoke as eloquently then in that session as she just did. And so thanks to the two of them, we got inspired here at St. John's. That was the inspiration. And both of them have been mentors and friends and helped us on this path. And with that, I'll turn to John Ross to give you more details about that.
Thank you, Ann. And I just got to say what an honor and a treat it is to be on the stage with this group of folks. Every one of them has been critical to, we're the new kids on the block at Nourishing Bethesda. A wonderful conversation with Kendra, but with Lisa Reisner and Ann as we were thinking about putting Nourishing Bethesda, putting it together and what was it going to be. We were on the fence, and her words, I mean, I think you got a sense of them, just hearing her, were so inspirational that they sent us. I felt like I was injected with something. I went racing out after that conversation and said, okay, we're going to do this. Let's figure it out. What are the obstacles? Bang, bang, bang. It was such an inspiration, Kendra. And, Jackie has been just a mentor all along the way. Just being there and answering our questions, regardless of how simple they seemed, now how naive. Gabe has been just here all the time. To our earliest distributions, he would come and just be there and let us know and let our volunteers know that the county government was really appreciative of what we were about. And Heather has been with the Food Council, and all this has been just incredible behind the scenes support for just all that we've been thinking about and doing. It really does take a village. We began as a wing and a prayer, as a ministry of St. John's here. So many of you were a part of that in the middle of COVID. We understood, as Kendra said, that, that pandemic had really laid open the need out there. It really just ripped open the need of hunger. And we wanted to do something about it. We didn't know anything about how to a food pantry, what that was about. But in August 2020, we started and distributed food to 100 families. Fast forward 3 years, we're our own 501c3. We receive county funding, and we feed more than 5,000 people a month. We're hitting bigger numbers now than at the height of the pandemic. We didn't anticipate that would happen. We didn't anticipate that we would still be in business now. That was never really the idea. It's rough out there right now. The county tried a couple times to establish itself in this area, and it didn't stick. A lot of reasons. When we came out, it did stick. And I think part of that had to do, it was that from the get-go, our attitude was that we were neighbors helping neighbors. And that permeated everything that we did. We teach our volunteers, every single one that comes in, we have a conversation with. We're not handing out food only, we're handing out community. Because quite frankly, many of the food insecure and poor in our country and poor in this country are invisible. When they show up for social services, they're just a number. When people are invisible, that means they're not listened to. They're disrespected. They're not heard. They're not valued. When people hear that I work with a food pantry in Bethesda, they say, "Oh, John, there's no problems in Bethesda." I hear that all of the time. I was on All Things Considered. Bethesda, John, come on. Everybody's rich. Can't tell you how many times I hear that. Well, no, as we know, it's back to this invisible thing. There are extraordinary regions and areas and streets and high rises in this area of such affluence that are hurting. We see that every day. And that's why we really work to remove that veil of invisibility, to talk to folks, to get to know their stories, to tell them our stories. This isn't a one-way street. And one of the reasons I think we're successful too, we continue to push this, is that most people come to us when we ask them, how did you hear about us? And they'll say, well, it was somebody told us, a friend told us, and a neighbor told us. And that's wonderful, I think, because some of the statistics in the new Capital Area Food Bank report that Ann just referenced said that about 50% of the people who could really use food don't get to a pantry. They don't get to a church. They don't get free food.
Right.
Why is that? So our work, we really want to continue to do that. So we're friendly. So a neighbor or a family or someone says to their cousin, you should go to Nourishing Bethesda. They're really friendly. They'll ask you a few questions, but they're not going to really get into your business. They got good food. They're good people, right? And then we begin to stretch back into these kind of pockets of poverty where people aren't getting to a lot. That's what we're all about. So it's the dual questions of people also too, just not knowing that resources are out there. There's the stigma issue. Well, I don't want to be part of that. Or will they bust me? Or what will happen? And then there's the whole thing about people just don't know. We live in a county that suffers from a SNAP gap, very high SNAP gap. And that is lingo for SNAP being food stamps. That the number of people who probably would be eligible is much higher than the people that actually get it. We have, over the last year, we've asked about SNAP benefit participation. Our clients routinely turn down, we were about 11%. But when we do some other kind of checking into, ask people voluntarily about their income, it would appear that up to 80% of them should be eligible. SNAP cap, what is that? Why is that? So we're training through the Food Council, our volunteers in SNAP training. It's the forms are, I'm a writer. English is my first language, and it's hard for me to fill out those forms. Imagine if it's your second language. So we're committed to being on the ground and to work with people so that we can get that done. That's an area that needs a lot of work. Flips back, Mark Elrich announced a few weeks ago, really wonderful news. Montgomery County, 1.5% unemployment. 1.5%. That's nothing. That's fabulous. And yet, we have huge food insecurity. Now, there's some variations on the numbers. We're talking anywhere from 10% to 27% in Montgomery County. But any way you look at it, there are a lot of people who are working, but they're not making it. Right? So what is that about? That gets into some interesting things. We need to talk culturally on a very large scale, how we pay people, how we respect some of the jobs that need to get done. So and we see our folks, they're working more than 40 hours often. They're working a couple jobs. They're taking, we have people who take 3 buses sometimes to get to us, 3 buses to go get food. They have to take 3 buses home. These are folks who are working. They're working really hard. They're trapped. And we've been talking about this, Jackie mentioned this, in this really cycle of hopelessness that they can't get out, right? It's hopeless. We are bending everything towards breaking that cycle of hopelessness. Because food insecurity, quite honestly, is the tip of the iceberg, right? If you're having trouble paying for food, you're having trouble buying medicine, you're having trouble with your rent, you're having trouble buying clothes for your kids. You're not having good health. You're anxious. We see some depression, right? So what can we do? Well, we're opening our hours to try to accommodate people. One of the things that we did, and we got a lot of grief for it actually at the beginning, was that we really accept people who work in Bethesda but don't live here. Why would we get grief for that? Well, people say, we're not going to fund you because those people need to go to pantries where they live. Well, it's a little bit of a problem if you're working huge hours, right? And all your daylight hours, either commuting or working, right? So how can you get to the pantries? Because they're not open when you do, right? So we are open then, and we encourage people to come who work in Bethesda. So we'll put food bags into cars of maids with all their vacuum cleaners. We'll put food in the back of delivery vans. We see so many people who are wearing the smocks from the food service thing where they just took a break to come out. It's not a one size fits all kind of thing going on out there. We all have to work in so many different ways. And what's wonderful about all the people on this stage, we're all coming at this and supporting each other to work and to nail these things. Because I was stunned to learn, when we went, and where's Sharon? Sharon's back here. She's our offsite person. And we went into a low income senior high rise.
Right here in Bethesda.
Right here in Bethesda. And we needed to determine not every, I think the income there is about $9,000 annually a year. It doesn't mean everybody's food insecure though, because some people may have families to support. So anyway, we had to talk and find out from everybody what the level of food insecurity was. Well, we did a questionnaire, but we had to do it in 6 languages. So that's just some of the things we're seeing. When we were hit hard with a lot of Afghans coming in, when we jumped out of there, the county came to us and said, can you help us feed some folks who are waiting for housing, right? They were all sending their money back to their people in Afghanistan. So we stepped in. We're seeing Ukrainians, South Americans coming in the middle of the winter without any warm clothing, that kind of thing. Anyway, I will wrap up, but
In the interest of equity.
yes. But I think that exactly, I just really just want to end with our folks really want a shot that we serve, want a shot at the middle class. They're hardworking. They want that. And I just think we need to help them with that chance.
John, you mentioned so many things that are important, but 2 of the things you mentioned emerged from the Capital Area Food Bank report too. First of all, that about half of the people who need food aren't getting it from the network. There's some accessibility barriers there. We should talk about that. Secondly, that the profile of the people who most need food, a big percentage of them are working families of color with children, working often 2 jobs or more. And they can't make ends meet. That's the justice issue you're talking about. So we have to address all those things. So we'll turn to you, Gabe. And
Well, thank you so much,
thank
Reverend
you.
Ann. And hello, good and blessed people. It is wonderful to be with all of you today. And let me just begin with expressing my deep appreciation and respect for this parish. Not just in this particular instance, but over generations, St. John's has stepped up to address the needs of our community in a myriad of ways. And for a little context, I was born and raised here in Montgomery County, grew up in Bethesda, and spent most of my afternoons when I was in middle school and high school at the Leland Community Center, participating in their after-school programs and open gym. And so I'm deeply familiar with your parish, and now as chair of the Health and Human Services Committee, incredibly thankful for your dedication. I see a lot of familiar faces in the audience, people who have volunteered, not just through Nourishing Bethesda, but in a number of other capacities as well. And it's that volunteerism and that spirit that gives me tremendous hope for the future of our community and our county. But let's be honest, it's tough to find that hope these days. These are very dark and confusing times. And it's important that we come together as a community in the way that we did during COVID, but to ensure that what happened during COVID and this incredible ecosystem that helped get Nourishing Bethesda off the ground is sustainable and expands. And so, for a little bit more context, when I first got into elected office, which was 5 years ago, before that, I served as the director of the county's recreation department for 12 years. And having grown up in Bethesda, but having lived in Gaithersburg when I was young, but being in a position to be all across the county, it really gives you a unique perspective because you see the pockets of need that are growing exponentially, literally as we speak. The distribution of wealth in our country has never been more disproportionate than right now. And unfortunately, we are really seeing the impacts of that at the local level. The county is fortunate in that we have this incredible infrastructure, not just of government services, but of nonprofit organizations and community-based organizations and faith-based organizations that really get it, that have been incredibly strategic in the way that they have carried out their programs and services, leveraging their constituents and congregations to be able to reach more people. But we've been tested in these last 3, actually 4 years in ways that none of us could have ever imagined. And I know you will all remember the government shutdown of 4 years ago, but that was one of the first actions that the previous council had to take, was helping to shore up our social safety net at the time. What we saw was tens of thousands of county residents that had been right on the line of poverty, getting by paycheck to paycheck, making it through with a little bit of savings that they had been able to garner. But that government shutdown tipped the scales. And over time, a number of nonprofits stopped receiving funds. And we started to see the lines grow at all of our different facilities and programs of people in need. And that obviously concerned us deeply. But then flash forward a year later and COVID hits. And we're all familiar with what happened. We all lived it, we all felt it, we all experienced it. But those that were already vulnerable really fell off a cliff. But what happened was something also extraordinary. The systems that we had established, the infrastructure of programs and services grew. And the county stepped up. And we were able to partner with organizations that were on the ground to not only be able to provide them more resources, but to help them with data collection, to be able to be more strategic in how we were delivering services. And organizations such as Nourishing Bethesda came to be, as well as the Up-County Hub. MANA was incredible in helping to support these new and emerging organizations. The Montgomery County Food Council, where Heather Bruskin was serving, was also helping to provide a roadmap. And we all sort of had an aha moment during that time. When you've got all of these organizations working together, a lot of us thought to ourselves, wow, why don't we institutionalize this? And if we do, let's be bold. And that got us thinking we can do things like end childhood hunger here in our community. We have the infrastructure, we have the staff, we have the political will, we have the resources. We just need the organization. And we have to address the underlying issues that are leading to food security in the first place. So last year as council president, it's a 1-year term. You get a slightly better parking spot and an extra $50 in your paycheck, which is not worth it, let me tell you. But you also have the opportunity to drive the council's agenda for 1 year. And you sort of get one bite at the apple of an issue that you want to focus on as council president. And I chose food insecurity as mine. And we helped put a little bit of funding together that launched an initiative to develop a strategic plan to end childhood hunger in Montgomery County. And that was unveiled just a couple of months ago. We had a work session about it just last week. And in a moment, you'll hear from an extraordinary leader in Montgomery County who is tasked with helping to operationalize the recommendations that are in that plan. The recommendations range from bold to low-hanging fruit, but all of them are doable. But we have to assert some political will at the federal level. We have an incredible federal delegation led by Congressman Raskin, Senator Van Hollen, who get it. But they need our help to convince their colleagues in Capitol Hill that this issue is something that we all have to focus on. There's a lot of political power in this room. There's a lot of political power in this community. We have to leverage it more effectively than we have been because we have to break the cycle. And so it's going to mean getting a little dirty. It's going to mean getting a little loud. But I'm confident that working together, we can do just that. So I look forward to the roundtable discussion and getting us back on track here for time. But thank you all so much for being here. It truly is an honor and a privilege. And with that, I'll turn it over to Heather.
Oh, well, thank you so much. I'm sure that none of you envy me following these incredible, inspiring voices.
But
and
your office is so very important to this effort. So yes.
Well, I still have my things to say, you know. Thank you. But I'll just echo what an incredible honor it is to be a part of this conversation today and to play my part in a much larger community-wide initiative that we all see as critically important. And so thank you so much for convening the conversation. So I am here both as the director of a brand new county office, but also as a community member. My husband grew up just about a mile from here. We can walk to visit my in-laws after this if we want. But he also, I come from Maine. My dad's visiting here. He's in the office or in the room today. But really, it's something that we do all have a role to play in addressing. And I have a new opportunity after 20 years in the nonprofit sector to launch the county's new Office of Food Systems Resilience. And I share often that I'm incredibly honored to have the chance to launch this new initiative because government has unique tools. I appreciate that speaking from the heart is not often the perspective that you have when you talk about government speech, but it is in this case a real priority of our entire county government to bring that food sovereignty, which I appreciate Jackie framing so meaningfully, of food insecurity in some ways is having consistent access to food in this moment, in this week. But food security truly also is a goal that we have for our entire community well into the future, because there is economic accessibility and consistency, but we also are facing the impacts of climate change on our overall global supply chain. We've seen how fragile that is coming out of COVID. And so we also recognize that our local economy and economic opportunity also have a factor to play in food security initiatives. And so we almost have two challenges to address, ensuring immediate food security for our residents and our food security as a community in the decades and centuries to come. And so our office was created really keeping both of those priorities in mind and building on the lessons learned from COVID that government does have those unique tools. And often, especially in emergencies, food resources for food security work are funneled through local government. And so while we have an incredible and vibrant nonprofit sector that leads this work, and I will just reflect that the county does fund over 70 food assistance provider organizations here in our county, over half of which are nonprofit, or they're all nonprofit organizations, but half of them are faith-based communities. And these houses of worship are the essential structure that the daily food security work of our county is based around. But with COVID not ending, but the pandemic resources scaling back, We are in a difficult position as a local government because a lot of the innovative and critical services that were not pandemic specific, but we were able to provide with pandemic era resources have gone away. At the same time, the resources that our residents have been relying on for food access assistance are also going away. I think a great example of that as a figure that I share regularly, in February, our federal government made the decision to end pandemic emergency allotments 3 months early. And what that meant was that each resident and household that was receiving SNAP and had been getting the maximum benefit that their family could receive on a monthly basis was now going back to whatever their standard allotment would be. I think we all can agree that that amount is insufficient in either way. But in Montgomery County alone, that meant that $7 million in SNAP benefits has ended. And we also can recognize that we don't have the local resources to close gaps like that when they were insufficient to begin with. And so we now have a greater issue to address with fewer local resources. And so that means that we need to be as strategic as possible and as data-driven and innovative as possible. There's really exciting work happening related to food sovereignty around the country. Some of it is happening right here, but there are new ways of doing this work that we need to invest in, while also using new data tools to better understand the extent of these challenges right here in our community. Data isn't very exciting. It doesn't often associate with speaking from the heart, but our office has a team of 3 people, and one of them is dedicated exclusively to data because the numbers are so far ranging, because this isn't a static landscape. And we're also, for the most part, really leaning on local data that's been extrapolated from federal resources, income level data, but food insecurity is far more complex than that. And so we need to create local tools to better understand both the extent of these issues and also the impact of the investments that we're making to address these challenges. So we have fewer resources, need to better understand the extent of the issues, and we have broader issues that we need to address related to food. And so these investments really do need to be strategic. And so just a few examples of how we can, at the same time of addressing immediate food insecurity, build our local businesses, address inequities related to economic opportunity, support our local farms. And these are all issues that we used to look at separately. And now through our office, we can look at them holistically and connect efforts within government as well as our partnerships with community to do this work better. And so in the childhood hunger plan, there are recommendations like food is medicine, where we can partner with our healthcare providers to provide prescriptions to produce and address diet-related disease, and also the challenges of income insufficiency to afford more densely nutrient foods, while also partnering with the private sector to make those connections and get better data to understand how that impacts the health of our residents. Similarly, we can look at ways to supplement the insufficiency of benefits, whether it's a SNAP or WIC, and reach so many of those residents who, for a wide variety of reasons, whether it's citizenship status or income insufficiency, are unable to maximize those benefits. And that's getting back to what John was talking about before. And then at the same time, we're also carefully stewarding constituent dollars because that is critically important, and it is a balance that we have to watch very carefully as partners within government. So there's a lot more to say, but I think the most important thing is really just underscoring how with each dollar that we invest in food security work, it needs to have as many multiple values as possible so that we are feeding people in the moment, but we are also using those dollars to create economic opportunity, to support local food production, to fight climate change, and the many other challenges that we have on our plate as a community.
Wow, thank you so much, Heather. There was a lot in what you said and what everyone said, but I might just draw out a few themes and then we'll turn to the audience for questions. But I'm glad you mentioned food is medicine, because we have to think not just about the costs of feeding people today. We have to think about the costs of not feeding people today. What does that mean for the long term? The health ramifications. There seems to be a much greater appreciation that by not investing in healthy individuals in our society, by providing nutritious food, this is a problem for the longer term. So if anyone would care to comment on that, I'd be interested in hearing about that.
Yeah, so we received a very sobering update on the academic gap in Montgomery County Public Schools earlier this week. 24% of Latino third graders in Montgomery County are reading at grade level. Let me repeat that number. 24% of Latino students in third grade in Montgomery County are reading at grade level right now as we speak. 38% of Montgomery County Public Schools population are Latino students. We have a catastrophic issue that is growing. And there are a number of factors that are leading to this. Food insecurity is one of them. Students that aren't sure where their next meal is going to come from add stress. The economic conditions and challenges that their families are facing, the mobility that they literally go from apartment to apartment to apartment. So the housing instability is profound. And so when you lack something as basic as food and nutrition, it impacts everything else in that child's life. And so it is medicine. And so we have to think about that and have been working with our pediatric and healthcare community who really understand and get this. And for example, this year we launched the Black Physicians Network, which is a coalition of Black physicians here in Montgomery County that partner and help collaborate to be able to provide better care to their patients. We are providing them and arming them with all of the information on the 70 or so organizations that receive funds from Montgomery County, the various services that they have available to them, particularly in the food security space, and are also directing them to areas that can help them with cultural competency. And so that, if a family is from Africa or from Ethiopia, we can help pair them and find organizations that will be able to provide food that make the most sense for those families. So it's critically important that we think about this holistically and that we really change the paradigm in how we think about food insecurity. And so that's why of many of the recommendations, when I saw that one, that was another aha moment for me, and one that we're going to have to double down on.
Thank you very much. Anyone else want to comment on that one? Thank you.
You've got a long list.
No, I did. Heather, I think, mentioned also the fact that we have some innovative new models for how we can deal more efficiently and with dignity in provision of food to populations. And I think that's super important given what you said about food justice, right? And MANA pioneered choice pantries, right? And has one of the models in the county for that. I wonder if you could talk a little bit about that, Jackie. And John, we talked about the fact that the tip of the iceberg, right? That food insecurity is just one of many issues that affect people. And that when they are in need of food, they need other services. And so there's this concept now of providing more holistically wraparound services, right? As well as food. So would you mind commenting?
Be very happy to. Thank you. So the choice method at its most simple is that folks who are turning to MANA or any other group, instead of receiving a pre-packed box that may even be filled with nutritious items, but items that we decided needed to go in there, can be replaced by kind of a supermarket setting where the pantry is laid out where based on your household size, you can choose what's right for your medical conditions, the age of your family members. Seniors need different food than kids need. And you pick it out, you choose what you want it to be. And we, right before the pandemic, I was explaining this to someone else, we had a ribbon cutting at our marketplace that allowed people to shop. And then we had to revert back to the prepackaged boxes during the pandemic. And but that actually, one of the lemonade out of lemon things is we've broadened our notion of choice. For some families, they do want the pre-packed boxes because, as was described, they're coming to visit us on their lunch hour, or lunch half hour, and they want just to pop that trunk and get Nourishing Bethesda or Manna or whomever to put a box of food in. That's their choice. Or some people, because of their physical disabilities or their age, need a delivery. So you mentioned apartments for seniors. We work with Montgomery Housing Partnerships, and we do distributions where the residents, counselors figure out who could best use the food that we offer. So we have deliveries, we have drop-offs, we have good food and welcoming spaces at our choice pantry, but also we have modified choice in places of worship, and also at the universities of Shady Grove. We have a choice pantry there that is open for the students, of course, but the professors, the maintenance, the staff, and also the people across the street who come mostly from a senior housing. So for us, choice has evolved. But then I would also like to add, and it speaks to what Gabe is saying, is that we are trying to get choice, and you also mentioned the SNAP gap, choice empowerment by putting money in the pockets of folks through SNAP benefits, but also through a vouchers program. So Heather mentioned supporting the local economy. During the pandemic, we got feedback from the Ethiopian community in particular that they really appreciated the staples we were offering, but that it was not going to work for them because of the stigma. And also because we just didn't have access to the spices, the injera. So we started a voucher program, and we now work with businesses that were losing money during the pandemic. They got, basically our participants will receive a voucher for about $45. They can get some basics at our place, but then they go shopping in their local Ethiopian market, Asian market, Latino market for what, again, is right for them. And one of the pieces of advocacy that probably Gabe wasn't thinking of is that we're not able to get county funds for that. We're not able to get county funds for gift cards when we give parents at the schools. We're working in 50 different schools because there's concerns about fraud or accounting. I'm not sure all of the reasons you guys have, but but luckily we have unrestricted funds from people like you. So when we raise money from individuals or congregations, we can spend that money however we want. So I just say one of those novel pathways is just giving the people the money that they need to buy at the right store at the right time and come to this network of 70 organizations when that's right for them too. I probably took everybody's time. I'm sorry.
So yes, yes, and yes. One of the strategies that we have been able to implement as it relates to addressing root causes. So we all know, or some of us know, about the social determinants of health and how there are factors that are interlocking that impact why someone is in the line in the first place. And so we have faith and we also have justice. So what we've been able to do is leverage, again, our resources. And I'll continue to say that there's always something. So we had a building that we had already purchased, a 6th floor, 96,000 square feet building. And we were trying to decide what to do with that building. So now, as a result of what we experienced during the pandemic and as a result of the food insecurity and seeing people, as you said, that come and they also have concerns and issues in other areas of their lives, employment, access to healthcare, being able to have, skills in order to get gainful employment. So we've now transitioned and expanded the vision to the community that we serve, which is regional. So we have a regional perspective as well. We serve in 2 counties and now we're serving in 3, which brings us challenges. So we serve in Prince George's County, Montgomery County, and Howard County. So we have a regional perspective because, as you said, people aren't as concerned about the boundary line. They just want to get their needs met. And so if I live in Montgomery County, but I work in Prince George's, which is only less than 5 minutes down the road, I'm going to go to the place that's closest to me. And so because of that, we're now opening the Kingdom Care Center, which is going to be a regional resource hub that will also have the client choice. And thank you, Jackie, and all those other organizations that do client choice grocery stores will have a fresh food market, 10,000 square feet of a fresh food market where residents across any of those counties can come and receive food. But in addition to that, we're working with partners to provide the other services. So our intent is not to do everything. There are great people already working in the community. So we have collaborations with Holy Cross Hospital. They will have residents in the building. Prince George's Community College, Volunteers of America. These are organizations that are already, anchor organizations already working, and then they will be co-located in the building. So when someone comes to get food, I can also be able to access affordable health care. I can access support with employment, all in one place, because we understand that one of the challenges we face, listening to you, Gabe, is that we've taken on also along with our partners is how do you close the racial wealth gap? It is huge. And that is one of the root causes of poverty in our nation, is that we have a huge gap. And it really does come down to how can I increase my household income, and how can I get a better job, and how do we close that gap that we might be able to support others so they're not consistently utilizing our services, but then we're able to make room for others. So that's one of the ways that we're now starting to move beyond providing the food, but also now looking at all those other cross sectors that impact, and then bringing them together that we can work collaboratively across sector to respond to the need.
Amen. I think working in this business, and certainly Kendra knows that. I was thinking it was all about food, but now we are just backed up into really facing these, how can we work with them to break again, that just keep coming back to that cycle of hopelessness. So people feel like they're coming up, grabbing water, grabbing a breath, and then they're sinking again and just coming up. How can we break that? When we when we query our folks about what they would like, top, obviously healthcare and things like that. But really importantly too, they are very interested in knowing fiscal kind of literacy. They want to know, well, how do you get credit? What is a mortgage? How can I establish a bank account? These are words, and these financial literacy, these are real people who really want to know so they can do it on their own terms. And so we are backing up. And again, we can't do everything. So collaboration is all what we have to do there. But these are, kind of, critical parts. And we are working towards, by the middle of next year, we're going to have a choice pantry by hook or by crook.
One last question, then we'll turn to the audience. So if anyone has questions, if you just want to go to the mic. But Heather, maybe you can address this one. Sometimes when I go to the restaurants and the food grocery stores around here, apologies. One more question, then we'll turn to the audience. Sometimes when I go to restaurants and grocery stores in the neighborhood, I look around at all the food and I think, what happens to all this food? There's leftover food. What happens to leftover food? What is going on with food recovery? And how do we make that part of the answer to this problem in the short term? And this is not the big issue, long-term justice, but this is, why are we throwing away food when people are hungry?
Yes, I appreciate that question very much. I think Jackie might actually probably be have a good perspective on that too, as Manna runs Community Food Rescue, which is the county's food recovery program. And so I'll let you speak to that. But just one comment is that I have been meeting regularly with the county's new climate change officer and we work very closely with the county's Department of Environmental Protection, because the intersections of the food security work that we do and the sustainability and environmental impacts are critically important to look at through that systems lens. So food recovery is not, I wouldn't say, the solution, but it is a tool. And I think just speaking almost to the previous question, we hold up as the North Star in our office the vision of what do we truly want for our residents, or what do we hear from them, and what do we see as the food system that serves them best. And certainly the tools that we've been talking about are important, and whether it's food assistance services, whether it's benefits access. But I think it's important to always underscore that what we truly vision is where people can access food wherever they want, if it's at a restaurant, however they want, and define that food system in whatever way serves them best. Do they want to grow it? Do they want to have access to gardening? I think those are the most important things to keep in mind as we have these conversations. And there's the element of dignity that we don't want food to go to waste. And we want to make sure that we are harnessing those supplies as the tool in our toolbox. But that is not the end point of where we want to go, is redistributing food in a system that's broken for so many of our neighbors. Yeah.
Thank you for making those points, Heather. That's really the crux of it, is that it comes up so often. Well, there's food waste, so we just need to get it to everybody. But we don't want to perpetuate problems that are problems for the climate, and then that are also just keeping people in this routine of accepting what is left over or discarded. But I will say that we do administer a network of both food providers, so restaurants, farmers markets, catering companies. And then when they have surplus food that is fit to eat, food with dignity, they can be matched with any number of different food assistance providers. So it could be Bethesda Cares here in this neighborhood. And when we marshal volunteers, people like yourself, who are willing to use an app, we have technology that's on your phone, and you get a little ding and say, you can pick up from a location in Bethesda and then drive it over to Silver Spring. We have the technology allows the routing so that you're hopefully not going all around this beautiful county. You're going to a place close to you. You get to choose if you want that food run. And then that food runner gets that food to the food assistance provider. And it can be a scheduled run after farmers markets. We do that at Olney. We do that in Bethesda, or it can be a just in time. The just in time, and this is an opportunity to give a shout out to Reverend Kendra and others who are trying to find the right locations for food storage. So a mobile app, that's cool, that's hip, that's now. But really, you need to keep the food safe. And so we need enough refrigeration. And so a lot of us are trying to work to make sure that there's a network of food storage so that we can make sure that that food is kept safe until it gets to the right location.
Wow. Thank you so much. Does anyone want to come to the mic and ask a question? If not, I do have a long list. But please. Please, we ask that you come to the mic so the people on Zoom can hear.
Hello.
Can you tell us who you are?
Sure. My name is Lisa Gore. I'm actually a resident of Chevy Chase, DC. I'm the ANC commissioner for, if you guys know DC, you know, we have ANC commissioners. So I'm chair for the Chevy Chase ANC. One of the things that I'm very interested in and members of my community are interested in is this topic. And as you all, I'm sure know, DC has a huge food insecurity issue with our senior population. We're also concerned about our kids that have a high food security and situation as well. I'm curious to know from you all, have you all looked at or considered food distribution within the school systems? I have looked at, I'm loving the shaking heads. I've looked at a pilot that was done, I believe in Atlanta or Georgia, where they actually had a school that had a store that was filled with food. And you guys are talking about bringing, you know, the food and those issues directly to where people are. Well, when you think about our kids, and you mentioned the Latino kids and the issues they're having, it would be, I thought, a wonderful idea to incorporate that into schools, where you take some of that shame off and it's right there where they need it. They don't have to go anywhere. So I'm curious to hear if you guys have thought about that, and if you have, what kind of challenges, especially from the legislative side. I'm really interested to hear your opinion. Thank you.
Well, thank you. That's serendipitous. And thanks for your service as an ANC commissioner. I really appreciate it. It's a thankless job. So, just lots of thoughts on that. And again, serendipitously, we just had a work session on this last week before the council. And I need to recognize Marla, who was the head within Montgomery County Public Schools for a number of years in helping to address food insecurity issues and was a leader within MCPS for many, many years. So thank you, Marla, for your years of dedication. we can't end childhood hunger without our school system. And they are undoubtedly in the best position to be able to address this issue systemically, specifically for kids. So during COVID, the rules were let go, and all children had the opportunity to be able to access. And so we effectively had a universal meals program in the state of Maryland and in Montgomery County. And what we found was it worked beautifully because it did lower the stigma. It did make sure that everybody had access. And it's something that I wish had been sustained even after we lost those federal funds, but unfortunately we lost those federal funds. Now, the county has been able to make up, not entirely, but to a large degree, some of the hole that existed prior to COVID. And so we are allocating resources both through the state and the county to help address those issues. And understandably, the school system is focusing on Title I schools. And it's extraordinary when you consider the operation itself. And I asked a pointed question. Let's say in a perfect world, the federal government gives us the resources that they gave us during COVID. Do you have the operational capacity in place to be able to provide both breakfast and lunches to every student in Montgomery County Public Schools? And the answer currently is no, but they do have the ability with additional capital resources to be able to expand their current operation. And they're pretty confident they can get there. And the other innovative thing that the schools have done recently, in partnership with the Capital Area Food Bank and MANA and others, is they have included food pantries in schools, in elementary and middle schools, Title I schools. I had the opportunity to go to the ribbon cutting for the Weller Road Elementary School pantry just 6 months ago. And one of the families that spoke got very emotional because they literally sent, we're in a place of worship here. They said it was a godsend. They've set up that pantry in the hours of operations, primarily through the staff of the school, but also volunteers within the PTA at times that working families can actually access. So weekends, evenings, Sundays, and it's making a really big difference. The last two things I'll say about our school system, and I know others are working with them closely as well, is that they really get it. They really understand the value and importance of this. And when I used to be the director of the recreation department, we did this big survey 14 years ago asking students what types of programs or services did they want in their after-school programs. You know what the number one answer was? Hot meals. Not snacks, they wanted hot meals. And so that was eye-opening for all of us. And that's a supper program, I think, is also something that we need to strive for as well. So that, this has to be year round. It can't just be within the school year. So we've significantly expanded the summer meals program, but that's something that we're going to have to focus on as well. And there's so many things I can say about this, but the other thing I'll just say, and then transitioning to colleagues, is, you think about snowstorms and when school is canceled, that is sometimes catastrophic for families, because that's the meal that those students are going to be counting on that day, that breakfast or lunch. And when you realize how many students are in that situation, it keeps you up at night. But the school system has got to be part of the solution, and they already are, but they need to be even more so.
So, and again, the perspective that I bring is especially for those who want to get involved and you're trying to identify how you can get involved. And so, and I think, Jackie, you mentioned this about faith-based organizations that, we focus on charity. Sometimes the challenge is that we don't know how to create the infrastructure to create something that's scalable and sustainable. And so what we've done is that we've worked with the schools, because we don't believe in duplicating. We do our best not to duplicate services, but we work directly with the schools. So we work with community schools We work with Title I schools. And even though we may not have a pantry in the school, we've worked with the school to create a process in a system to get the food to the young people that need it the most. So 3 of our distributions are at schools. 2 of our distributions are at the recreation centers. So going to where people are, where they have the greatest need, and then being able to create a system and a process around that is important. I also think that, and I appreciate Montgomery County for this and the funding that you all continue to provide, is because it's giving us the ability to be able to pivot our resources to build better infrastructure. So that now I'm able to work with other organizations that might be smaller and want to do the same. And now I'm able to teach and train them. This is how you create a program, and this is the infrastructure that you need in order for it to be sustainable and scalable. There are so many faith-based organizations that are focusing on charity that may have a desire to do more, but they just don't know how. And sometimes there's not funding to do it. So if I can get funding to cover some of my resources in the food distribution work, then I can pivot my budget to funding to now focus on supporting other organizations that may not do it the way I do it, but they have a area, they have a little piece that they can play. And then when we all play that part together, you're able to, how do you eat an elephant? One bite at a time. And so I think that's critical, supporting smaller organizations, supporting organizations that are led by people of color, supporting organizations that are in the community, and then helping them build the infrastructure. So it's not about competition or comparison. It's about how can we work collectively together, and you fit in that little piece that you need to fit in, and then I'll fit in the piece that I need to fit in, if that makes sense.
Yes, without duplication and building the capacity of the whole system. It's really great. Want to say something? Okay, yes. Oh, you have one.
If I could just add maybe 2 data points that I think are really helpful for contextualizing the scope and the scale of the challenges that we have related to childhood hunger. One of the few local level metrics that we have for the extent of food insecurity among our youth population is the Maryland Youth Risk Behavior Survey. And so that is an actual survey that recently had food insecurity questions added to them. It's administered every 3 years. In 2020, the numbers indicated that our Black and brown high school students in Montgomery County were 5 to 6 times more likely as compared to their white peers to be food insecure. In 2023, when that number came out, it had risen to over 10 times of the disparity. So I think it's really important to be looking at those local level metrics wherever we can to understand how inconsistently and inequitably these issues are impacting our residents. I think the other that I would note is that the eligibility levels for most federal benefits, whether it's SNAP or free and reduced rate meals, is about 130 to 185% of the federal poverty level. That number isn't shifted based on local cost of living. And so in Montgomery County, we have a self-sufficiency standard of about $100,000 per year for a family of 4. So that's very basic needs. That's housing, healthcare, food, those various key pieces of living. And that's equates to about 400% of the federal poverty level. So in Montgomery County, we have over 16,000 households, not individuals, but households that live in that gap of about 150 to 400% of the federal poverty level. And so I don't know if I'm allowed to assign homework, but I would just note that in addition to direct service, advocacy to me is also a form of direct service because the more that our federal government and our state government covers the costs of these programs and these needs for our residents to address those inequities and to support the overall self-sufficiency of these families, the more money we have locally to close the gaps. Because so many of these families in Montgomery County are uniquely ineligible because of our high cost of living and because of the incredible diversity in a wide variety of ways of our families here.
Thank you so much. Yes, yes, I want Carolyn. Is Carolyn still there? Bill, can you give her the mic so that she can
running, I had responsibility for the food program, 5,500 kid high school in South Carolina, where half the kids were really rich and half were not. So I get this, but I want to go back to something else. I want to go back to your the comments about food, saving food. We really need to talk about behaviors. Because if you can change behavior, you can change attitude. You can't, it's very hard to change an attitude. If you change a behavior, pretty soon the attitude goes. I spent last year looking for a Rotary Club to join. One of the places I visited quite often was one that met at a country club. And finally they said, "You want to join our club?" And I said, "I have an issue with the amount of food you waste." Because they was sort of family style with a lot of food left. And they said, "Oh, no problem. The people in the kitchen get the leftover." Well, okay. So I think we need to talk about how to change behavior. And the behavior will go with the attitude. So if we talk about extra food, what to do with extra food, making it the idea that you can pick it up, move it across the county, great. But we need to talk about the fact that we could plan better and not have lots of food. The second thing is in Europe, in the UK, there's an example of changing behavior. People have an extra onion. They can take it to a local refrigerator with glass doors on it, and somebody can go and get the onion. And the refrigerator, there's a system, I've forgotten what it is now, is how it tracks it. So the technology's there, but we need to think about the behavior. We need to think about the behavior.
As we said before, amen, we agree. And I just want to say we have a lot of work to do, but we are on some of the right tracks. Especially around at Mana, as I mentioned, we share food, we educate, we advocate. The education piece also comes through our community food rescue work. So we, with the other groups in the DMV every year, celebrate Food Recovery Week. And what we try to do is webinars and farm tours and opportunities to glean from local farms and our ag reserve. But we also teach how you can avoid food waste in your own kitchen. Now, that's a behavior you say, well, then that's just feeding your family. Well, okay, but then you start realizing, how much food do I need? What is menu planning about? It changes behaviors around nutritional content, as well as how can I spread this meal, because I have something that's left over. Maybe I put it into a stew. I'm not a very good cook, so I'm not coming up with good examples, but you get my point. So we agree with you that we have to educate people, not only those who turn to us for food services, but those community members like yourself. I want to add on to one of the things that Gabe was talking about. One of the great things about these school pantries is it's that the moms and the grandmoms are the volunteers helping. In many cases. So just how we as a community can stop saying, oh, you're the one who needs food and I'm the one who gives you food. We all need to eat and we all need to prepare food. And so how can we learn together? And people are always saying, you know, nonprofits need to put themselves out of business. I had one of my employees once was like, won't that mean I'm out of a job? And but I just say, we want to keep our doors open so that people are standing in line to take cooking classes and to take how do you make jams and jellies and all that. So we have a lot more work to do. The Food Council, which has been referenced here a couple of times, is a multi-stakeholder group. They have active work groups around food literacy. I know they restructured recently, but still join the Food Council. That's a nonprofit. Yep. So there are ways to get involved in all of the different elements of raising food, processing food, sharing food, and saving food. Yes. Oh, sorry, John.
I just have a question for you all. This is something I don't know much about, but I know that California has done some really wonderful work with outlawing food waste with restaurants and grocery stores and all like that. And I don't know when that's kind of coming this way, but is that on anybody's radar in terms of, talk about changing behaviors and attitudes? Yeah, is that percolating at all?
So I think it's important also to think about kind of two main buckets when it comes to food waste. And we have the household level, and then we have the sort of institutional level and the large scale generators. And so when you see policies they're usually targeted towards public institutions or large scale generators. And so one of the goals that the state has, and there was legislation passed in the state of Maryland 2 years ago to reduce food waste, was requiring for large scale generators. So those would be restaurants and grocery stores and things like that, to either redirect for human consumption or animal consumption, or if you couldn't do either of those things, then take it to a composting facility. One of the challenges that we have in almost every food space is the lack of infrastructure to support our vision for all of these policies. And so in Maryland, we actually don't have sufficient capacity for processing food waste for composting. And so I think it is often those things that kind of hold back putting teeth behind the policies that are created at the state level, because they're actually kind of difficult to implement until we make investments in the infrastructure needed for their success. So I think from an edible food recovery standpoint, there have been conversations at the county level, but we also want to make sure that they're successful and they have the intended consequences. Because one of the things that we actually have seen, and I'd be very curious if my colleagues have seen this, we've been closely watching, is that when you mandate, corporate large scale institutions to do things, it has unintended consequences. And so one of our concerns was that you would see these institutions, because they didn't want to pay for the composting or the hauling or for complying, they would just then dump these products into the social services sector. And then that would just have trickle down effects to our community partners, having to then deal with the costs of what they do with those pieces or those products that were then not actually valuable for their purposes.
But no, just a observation directly to your point. There's a very large and growing nonprofit called Feed the Fridge, which does all of the above. It works with corporate sponsors, restaurants, and such. And there are dedicated refrigerators that are free access to people who have needs. And that's I looked on my phone real quick, and I think there are 3 or 4 in Montgomery County. One's up in Gaithersburg, another near Rockville, and there are a couple more, but they are, I think they came out of the pandemic. They're relatively new, and they are doing very innovative work in getting food that is excess to people in need, and they have means of keeping it fresh and making sure it's healthy and appetizing and satisfies dignity.
That was Deacon Sarah Thor. No, Marla, please.
No, but I thought I would tell a great story that you would be inspired with. So one of the things that we do in the school system is that students don't have to take everything in order for the meal to be a quote unquote reimbursable meal. So students only have to take 3 out of the 5 items. So what's encouraged is that they don't take more than they're going to eat. However, because they still have to take 3 items, instead of throwing an uneaten item into the trash, we created this many years ago. We created what's called the share table. And so the student takes what he's not going to eat and he puts it on a share table. And so at the end of the lunch period for food safety, share table stuff is collected. And if there's share table stuff at the end of the day, then we contact Community Food Rescue and they pick the products up and then can distribute it to families. So your idea is great. And there is a lot of thinking in the county that's supporting that way of thinking.
Thank you. David, did you have a question?
I was wondering if we could return to what the advocacy part looks like. You mentioned that because the putting on the apron and everything, that's the feel good stuff. But I can't help but feel like it's the advocacy, like pressuring Congress to bump up that level of what poverty is. It's the stuff that's really going to move the dial, but it's the stuff that's uncomfortable when it comes to frustration. But how do we do that? What does that look like? How do we push that? Can we get SNAP on the state level?
That may be relevant to talking about South Under, how we get that program.
Yeah. So, and I apologize. I have to leave after I provide this response. because I got to go pick up my son, but who's at a baseball game right now. But so here's the good news. This is a bipartisan issue. And there is Congressman Raskin would be the first to tell you that this is one of those issues where there's a heck of a lot of common ground. Now, there are some discrepancies. So some of his colleagues continue to believe that we need to make these forms difficult to fill out, or that there be forms. And I appreciated what Jackie talked about before. There are things we should do a better job of controlling within Montgomery County, and we are taking active steps in that direction. But one advocacy element is just to acknowledge that this is human dignity. This is a basic right. And, I'll say this is a life issue. And I say that as a Catholic. And we have to start thinking about this in ways that will really resonate and communicate with folks. I see the choir here. I'm preaching to the choir. But what we need to do is meet people where they are and explain why it's so unbelievably important and relevant to make it as easy as possible for people to access the federal services that are available. And then we need to expand those federal services significantly. There's no reason why we shouldn't have universal meals in our school system. We have to just shift in that direction. It worked so well during COVID. And so what I think that we need to do, and this is something that I want to tackle as a next phase from local elected official standpoint, is to derive a strategy on who to be advocating for at the federal level. And let's take advantage of where we live, so close to Capitol Hill and Congress. Many of these members live in our community, or their chiefs of staff, or their staff, or their congregants. Let's take advantage and leverage those relationships in a way that's effective, but with very specific asks. And let's be bold. So I think there needs to be more to come on that. I'm going to a big Democratic function event this evening. And it's something I'm going to be talking about because we have to really circle the wagons and be more strategic.
Gabe, is it fair for me to ask you before you go, what can we do to help advance the program to end child hunger? And how will that be funded? And where do we need to advocate to help give it the legs it needs to succeed?
Absolutely. So it's a 14-point plan. And again, it sort of ranges on issues that are within our control here in Montgomery County. Here's the good news. This is apple pie in terms of policy. So this has a lot of political will and support at the local and state level. We are going to have to make some difficult financial decisions within Montgomery County very shortly. The county executive announced recently, and of course this is going to receive support from the council, but he's sending over a supplemental appropriation in order to be able to fund some of these strategies. And so that will mean that we're going to have to refocus some of how we provide financial resources. And we have the infrastructure in place, but that could mean that some areas don't get as much as they received before. But we have to be strategic about this. And so I think some of that cover is important. Two other ways. The second is through philanthropy. So the Montgomery County Community Foundation and a number of other philanthropic organizations are starting to really invest more in their own backyards. And I think that, a lot of us woke up and realized, oh my goodness, there's need right in my own backyard. And instead of sending, all of the philanthropic resources to somebody's university, maybe they should be investing that money here in our own community. Or some of these national great organizations, but let's start investing in our own community because it actually does help our economy in so many different ways. Our nonprofit sector represents a really important part of our economy. And so we have to support it. And I guess the final thing I would say is that keep putting your foot on the gas. This discussion, the emphasis on this issue by this congregation, we need to sustain it because this isn't going away. This is something that we're going to have to continue. And now that you have an established 501c3 as the perfect conduit to harness this time, talent, and treasure, we got to keep it going. So, and also connect to other parts of Montgomery County.
Right.
Because we have
Engage
to
others
really,
in this work
yes,
too,
we
right.
really have to strengthen this ecosystem. Thank you all so much
Thank you,
for
Gabe.
allowing me to speak with you all today. These incredible folks are an inspiration, truly. And I look forward to working with all of you. Thank you.
Thank you. Thank you so much for coming. So. Another question, and I want everyone to think what your last word to this group will be, because I'll give you each a chance to leave one thought with them that you would like them to have before we leave. But anyway, Sharon, please go ahead.
Thank you. And great panel. Thank you. And I was so excited and inspired by the opening remarks, especially of Jackie and Reverend Kendra, and talk about justice, because, you know, when I think about this problem, I always think, well, you know, at root, it comes back to lack of money. It comes back to poverty. Poverty is increasing because economic inequality is increasing. So this problem is not going away without systemic change. And it's like, how can we be part of that? You know, the really big picture stuff. We, like Albornoz said, we are a community with a lot of power, a lot of connections, a lot of political, you know, interest, engagement. I think of things like corporate consolidation leading to fewer jobs, and that's one of the drivers of inequality. Tax policy and the starving of the IRS so it can't enforce even existing policies. There's so many things like that. How could we, as a faith community, as a leader, you know, join with other faith communities to work on these really big picture problems that are underlying all this, and which frankly, you know, nothing will really change unless we address those.
Well, thank you for articulating some of the things behind words like justice, because you've really touched on a lot of the different elements of, like, we've talked about the SNAP benefits or the emergency allotments, but earned income tax credit, tax credits for parents with kids. Those are things that have gone away, even though we saw that they worked. And it's really frustrating when something works and then we take it away. But I will take a twist on what Gabe was saying. There are important national organizations that we should be engaged with for advocacy. So at MANA, we rely a lot on Share Our Strength, the Food Research and Action Center, which has Maryland Hunger Solutions, but also we're involved in a network called Closing the Hunger Gap. So I think that if you as a congregation or as individuals try to look at what are some of the nationwide justice organizations that have people, I always say I outsource my policy team to those organizations because we don't have lobbyists and we don't have lawyers and we don't have people who have to sit down and read the Federal Register and say, really? That's wrong. So, you know, just align yourself with certain broad-based groups that will help with that bipartisan storytelling and getting making sense out of things that is going to lift up the entire country, not just Montgomery County or Maryland. That would be my suggestion. But there are lots of organizations out there.
I agree. I think Jackie said it well. We are partnering with other organizations that are doing this work. So locally, we are partnering with Greater Washington Community Foundation, who is launching a very large and robust campaign on closing the racial wealth gap. We are partnering with United Way of the National Capital Area that, again, we actually utilize they call it ALICE, asset limited income constrained and employed, where there are over 500,000 households in the Washington metropolitan area who they are working, but they cannot meet basic household needs. And so as Jackie shared, we don't necessarily have an advocacy arm, but again, collaborating with those organizations that are doing that work and finding where we can, one, be educated. So again, we are new to this work. And so one area that I've consistently focused on is making sure that I'm clear about what's actually happening. What is the landscape? What are the issues? And how can we as a local congregation respond? And that really would be my final word. You know, faith and justice are two sides of the same coin. And so where would God have me to focus my efforts and my energy? You all are doing a phenomenal work here. And as you get into the work, you begin to learn. And you begin to identify other areas that you find are interconnected. And then you begin to build partnerships and collaborations with people that are already doing the work. And what I love about this congregation is that you reach across. So we're in East County. We're actually located now in Prince George's County, but we were in East County. And so that's where our partnership began with St. John's. So East County, if you know the Montgomery County area, East County is the area that has the predominant percentage of Black and brown people, BIPOC. So when you talk about whatever the percentage is of Montgomery County that is low income or moderate, I guarantee you the higher percentage is going to be in East County. And so when you came across to partner, and then we bring our congregations together. So I just say, where can we collaborate? Where can we do it individually? But where can we do it on an institutional level? It gets a little bit more challenging on an institutional level, but it's still possible. And so what is that call that God would have for you? And how can you continue to take risks and get engaged, even in ways where you're like, this is a little, I'm not sure, but yet you sense that that is what is necessary, and continue to work together. Because we wouldn't be where we were without Montgomery County government, without the Food Council, without MANA, who's been doing this work much longer than we've been doing it. And so without St. John's. And so we are stronger and better together. That's my final word.
Oh, no. I would just have to say that every volunteer that comes through Nourishing Bethesda, we talk and we want to empower them to be advocates, to be knowledgeable about this issue. If everybody in this room just talks to one person in the next couple days about what they heard today, about the nature of food insecurity, and particularly with children, that it's bad, and share that, then you're doing wonderful work. And this is what we have to be doing on that level. Back to Jackie's point, 2021 to 2022, the percentage of children living in poverty in the United States doubled. Think about that in 1 year, largely due to the ending at the federal level of the expanded earned income tax credit for children. These policies work. And unless people who are holding the purse strings at the national level understand that they have the power to change lives in a positive way, and the way we do that is through every one of you being an advocate. So my last thing on this is, it's not somebody just for us to be advocates. You guys hearing this, you need to be part of this. People can't go hungry in this country. It's unacceptable. There wasn't a lot of anger on this stage. We should be angry about this.
Yeah. So I think my recommendation for where to take this as you walk out the doors would be probably 3 parts. Be curious, consider what you learn, and communicate that. And I think that is to get back at the question around advocacy. To me, advocacy is in every single thing that we do every single day. And I think a lot of times elected officials at all levels of government here, food security is important to me. And that is, if that's where you are and in terms of what you want to communicate, that is helpful. But where the value added advocacy really comes is in exploring very specific topics, learning more about it, leaning into your own curiosity. My background is in counseling, which people are always like, what are you doing here? And, and it really is that we are all people in this work together. And that is where the heart of the solutions and the strategies come from. And so whatever is most interesting to you, lean into that, learn about it, and then take what you learn and share it with. Your advocacy can happen at a dinner party or at a block party or in communicating with your elected officials. We're very lucky in Montgomery County to have the elected officials that we do. I will say they care about this work very much and they strive to support it. They also have a lot of things that they have to pay attention to all the time. Food is literally in my title. I have to work on this stuff all the time, and I'm glad for the chance to do that. But we need to remind them what is important to us. Frankly, even if it's for you, not food, if it is housing security, if it's income sufficiency, if it's educational and wealth gaps, that will support the food work too, because our solution really isn't about food at all. But I think that taking what you learn, I'm happy to talk about any of these things more in detail afterward. But the Food Council does have a monthly advocacy call where they highlight very specific things that are happening that's open to the public, where you can learn where your voice can be particularly helpful. But I'm just really grateful to all of you for being here and to you for hosting this conversation, because I think it is a very long process that we have ahead, but the fact that we're doing it together makes it that much more powerful.
Yeah. Well, thank you for not holding us to just one word, because I noticed my peers didn't do it. So, but my word I would choose is enough. And I mentioned I'm a Quaker. You may know Quakers use queries, questions. And so I would just, I know something that I have to continue to return to is what is enough? What is enough salary? What is enough food? What is, and bring it into my own household, but also into my workplace, congregation. So I would just think that if we can take a deep look into what is enough and does everyone have enough? It's a bit countercultural, but I think people of faith have a lot of answers to that question. But I'd like the word that Kendra used, risk. Risk sometimes going to those scary places to get the answer to that question is what is enough for our neighbors and for ourselves.
Enough is a theological concept. We'll do another discussion on that one day. Okay. Well, I'm going to thank our panel and our audience. But before we clap, I have one piece of good news I want to announce to everyone. Can you stand up, please, Margaret and Avril? These two wonderful women work at St. John's Opportunity Shop, which is a thrift shop that's been around for 75 years, 2 blocks up the street. And the money they make there is contributed to St. John's outreach ministries in the community and other philanthropies in the neighborhood. And yesterday, they were selling Halloween costumes and other wonderful things at the op shop. They made $1,777, and they're donating it today in honor of this town hall and all the work that all the volunteers here do to food service and food justice organizations. So thank you, ladies. Thank you, St. John's Op Shop. Thank you to our wonderful panel. I hope we can do this again sometime. And thank you to all of you, because I see so many people here who I know are involved in this and doing great work in so many ways. Thank you for coming.
Thank you.